Hi, my name is Jared Gollob. I'm Chief Medical Officer at Kymera Therapeutics. Sure. These were data from our phase 1b study of KT-621, our STAT6 degrader in atopic dermatitis patients. We had previously presented data showing the impact of the drug on biomarkers as well as on clinical endpoints in atopic dermatitis. This presentation at SID was really to focus on the biomarkers in particular, both biomarkers in blood and in skin, and if you will, sort of drill down deeper on those biomarkers and, showing, not only that our drug was able to achieve deep degradation of STAT6 in both blood and in skin lesions of these atopic dermatitis patients, but also importantly show that changes in disease burden as measured using this so-called EASI score, which is a reduction in skin lesion burden that we saw with our drug, was associated with substantial reductions in type 2 biomarkers in the blood, including TARC and eotaxin 3. And importantly, that reductions in itch in these patients, with itch being a very important symptom in AD patients, these reductions were associated with reduction of another important blood biomarker that is very important in driving itch, which is interleukin 31. So showing that connection between reduction in these blood type 2 biomarkers and clinical improvement in skin lesion burden and itch was very important. We also took a deeper dive in terms of looking within the skin at where we were seeing downregulation or reduction in STAT6. And we're able to show with immunohistochemistry that we were seeing very strong reductions in STAT6, both in the epidermis, in the keratinocytes in the epidermis, as well as in the dermis, where in the dermis is where you see a lot of the inflammatory cells that are, part of what leads to the signs and symptoms in these skin lesions in AD patients. So being able to show not just, quantitative reductions in STAT6 using what we call mass spec, which is what we showed in prior presentations, to be able to show exactly in which compartments in the skin we're lowering STAT6 and showing that we're lowering it in both the epidermal and dermal compartments was really important. And then lastly, we were able to show in skin to take a deeper dive on changes in gene expression, in the skin, especially genes that are driving type 2 inflammation and driving symptoms like itch, and able to show that we were having a substantial impact on the expression of those genes in these skin lesions, which goes along with the finding that we were lowering STAT6 in the skin as well. So we would expect to see a reduction in all of these mediators of inflammation if we're reducing STAT6, and we did see that. So that's really what we brought together, in this presentation at SID, this nice way of bringing impact of our drug on the target and on type 2 inflammation biomarkers together with the impact that we saw on the clinical signs and symptoms of the disease.